Good afternoon, and welcome to our second lunchtime conversation. It's part of our 55 and Better Expo, brought to you by the Loveland Reporter Herald and the Greeley Tribune. My name is Al Manzi. I'm President and CEO for Prairie Mountain Media and publisher for the Loveland Reporter Herald and the Greeley Tribune. Today's conversation is entitled Medicare Issues. I will moderate a brief question and answer session after today's panel discussion and presentations. So please feel free to enter your questions anytime during the presentations using the Q&A and chat features on your device. Today, we are joined by Travis Fenner with Humana Health, Carmen Cisneros of Northern Colorado Medicare expert with Kaiser Permanente, and Brian Fabrizio and Arlene Deitz, both with Ameri. So please join me in welcoming our presenters for today. I believe Travis Fenner will be leading us off. Travis?
Good morning, and thank you for that introduction. Let me share my screen. So my name is Travis Fenner. I'm the Humana representative for Northern Colorado. Just a fun fact about me, I am one of the few Colorado natives, and we don't have a lot of time, so I'm going to jump right in. We're going to talk about why Medicare Advantage plans. You're going to have a lot of options, and you're going to get a lot of Medicare 101s here in just a second, but we're going to, specifically talk about Medicare Advantage here with Humana, okay? Medicare Advantage plans, of course, you have to have your Parts A and B on Medicare, but the Medicare Advantage plans must offer at least the same level of coverage as Medicare Parts A and B, and many plans offer added benefits. These may include coverage for routine vision care, hearing aids, routine dental care, prescription drug coverage, and a fitness center membership. Advantage plans are called Medicare Part C. Again, you must have Parts A and B. There may or may not be a premium. The insurer determines the Medicare Advantage plan premium, which can vary from one Medicare Advantage plan to another. Some Medicare Advantage plans may have premiums as low as $0 a month. Your cost sharing may also be less under Medicare Advantage. For example, a primary care physician under Medicare Advantage, you may pay a copayment of $10. However, if you visit a primary care physician under original Medicare, you may have coinsurance of 20%, which could be more than $10. Also, a Medicare Advantage plan limits your out-of-pocket expenses. Once you've spent the maximum amount, you pay nothing for covered medical services for the remainder of the year. Original Medicare does not provide a maximum out-of-pocket cap, so your potential expenses are limitless. Often, a Medicare Advantage plan can be less expensive than comparable coverage if you would receive, or if you would stay with original Medicare. To get all the benefits of Medicare Advantage with original Medicare, you would need to enroll in a standalone Medicare Part D prescription drug plan, as well as a Medicare supplement plan. There are different kinds of plans under Medicare Part C. Of course, there's the HMO, a PPO, or a private fee for service. Typically, Medicare Advantage plans are managed care and have networks of contracted healthcare providers. Example, that would be the HMO. These HMO plans require you to select a primary care physician who helps you coordinate your care. Medicare Advantage plans that includes prescription drug coverage may also have medication therapy management. This care coordination can be convenient and a valuable aid to your health. Again, we have all your Medicare options. You're going to get a couple of Medicare 101s after me. So they'll talk about original Medicare, again, Medicare Advantage, original Medicare with a prescription drug plan, or original Medicare Plus. Again, you do have to have Parts A and Parts B for any of the Advantage plans, and again, they can come with a drug plan. There are special enrollment periods. You can change your Medicare Advantage plan due to special circumstances like moving or leaving a group plan. There's the annual open enrollment period, which is October 15th through December 7th. And then there's also an open enrollment period, January 1st through March 31st. Things to consider when you choose an Advantage plan. We have cost, benefits, convenience, and the providers. And that's the quick high-level introduction of an Advantage plan. Again, if you have any questions, please refer to me. I'd be happy to help and answer any of those questions you may have.
Thank you, Travis. And who's up next? I'm assuming it's going to be Carmen.
Hello, everybody. My name is Carmen Cisneros. I work for Kaiser Permanente. I've been in the Medicare market for over 10 years now. Fun fact about me is I have 11 children. My oldest is 34 and my youngest is 15. But my passion is working with seniors and low-income individuals. So now we're going to go ahead and get started. Okay, so headed into retirement brings a slew of new topics to grapple with, and one of the most maddening may be Medicare. Figuring out when to enroll into Medicare, which parts to enroll into Medicare can be daunting, even for the savviest retirees. So there's Medicare Part A, there's Part B, there's Part C, D, Medigap plans, Medicare Advantage plans, so many things to consider when enrolling onto Medicare. And it's not working. I do apologize. I'm not as tech savvy as my previous cohort, and it's not working.
Might be able to just click on your slides 1 through 13.
It's not clicking.
Go up to your first slide and click on it, your second one now.
Okay. So I do apologize. Again, I'm not as savvy as Travis. However, I am an expert in Medicare, so hopefully that
click
helps.
on your second slide and you should be able to just work through them that way. There you go.
Perfect. So to help you with this complicated federal health insurance program, we're going to go over a few things to consider. What is Medicare? Medicare is a federally funded health insurance program. Medicare was established in 1965. Medicare is administered by the Centers of Medicare and Medicaid Services, which includes 4 parts: the Medicare Part A, B, D, and C. What does Part A provide? It will provide you coverage for inpatient hospital care, also covers skilled nursing care, hospice care, and home health care. Most people don't pay Medicare Part A if they paid into Social Security, which is called premium-free Part A. There might be some times when you didn't pay for Medicare, in which you might have to pay for it. You could pay as much as $471 a month. However, if you have a spouse that has paid into Medicare, you may be able to use his Medicare quarter, so you don't have to pay for the Part A. Part B, which helps you cover doctors, labs, x-rays, durable medical equipment, dialysis, and some preventative services. How much does a person pay? Most people pay $148. If they're taking Social Security, it'll automatically come out of Social Security. If you're not drawing out Social Security, you pay the 148 times 3, which is quarterly. If you didn't receive it when you were first eligible, you could be penalized 10% for every 12-month period that you did not enroll. Now, Part D. Part D covers outpatient prescription drugs. You have a couple of different options on how you get the Part D. You can get it in the Medicare Advantage plan that includes the drug coverage. You can do it, you can get a standalone prescription drug plan or coverage through an employer. So when can you enroll? So when you first become eligible, so most people, when they turn 65, they have a 7-month period in which to enroll. 3 months prior, the month of, and 3 months after. You do not have to get onto Medicare if you are working and you have credible coverage. If you have questions, just call me and let me know. We'll go over all your options. If you need help with some of the Medicare coverage, like prescriptions, this provides extra help. So the low income subsidy provides extra help with the Part D premiums. It could be outpatient drug co-pays. If you need help, you can go to the Social Security website, or you can go to Medicaid, or you can give me a call. I'll be happy to call. I'll be happy to walk you through the process and get you enrolled. Not everybody pays the same amount for Medicare Part B, okay? If you pay taxes in 2019, and here's how the breakdown is. You can, the way that you file taxes, whether it's individual or joint, you could pay as the 148 or as much as, yeah, you get the picture, very expensive. So there are additional websites for resources. You can go onto the socialsecurity.gov, medicare.gov. You can go to a SHIP center, or you can always get a hold of me. Here's my contact information. Call me or text me and let me know how I can assist you. So that's it. We will have a panel discussion after this is over.
Thank you so much, Carmen. Next, we have Brian and Arlene.
Hello. Hello. We are with AmeriQuote, and we're a local Medicare agency. So instead of being with one specific company, our approach is to offer every company that's out there. And just like anybody that sells Medicare, our service is free to you. We provide that expert consulting and guidance. And like I said, we represent all major carriers. So what happens when we sit down with you, let me pull up my other screen. We walk you through a simple process. Explain Medicare Part A, Medicare Part B, just like you just learned about. Talk about the different plans, whether it's a supplement plan like Plan G, or with the drug plan, or a Medicare Advantage plan. But we can offer all the different companies and help you dial in to which company is going to be the best resource for you. And Arlene and I have been in the business for a while, and Jack, our business partner, has owned AmeriQuote for 30 years. So lots of experience, lots of resources, and we are here to answer any of your Medicare questions and take care of your Medicare needs. And, you know, just like right now, you see a lot of stuff on TV, hear it over the radio. There's a lot of the 1-800 numbers, but we're a local broker. And so you have somebody that can sit down with you every year and review it based on whatever changes in your life or whatever changes as far as the plans go. So with that, I'll throw it back. But Arlene Deitz, Brian Fabrizio, AmeriQuote Insurance. And that's it.
Well, thank you so much. Wow, there's a lot to uncover here. I want to see if we have any questions. We don't yet, but please feel free to add in questions. So let me ask you a couple of questions to get us started. What happens if you fail to file for Medicare during that 7-month period? What is the penalty? Is there one? That can go to Carmen. I guess she brought that issue up.
So if you fail to, thank you, Al. So if you fail to enroll, depending if you had credible coverage. If you were working for an employer and that they provided credible coverage, then there's no penalty. But if you just failed completely, it's 10% of the Part B cost for every 12 months. So this year it's 148. So it'll be $14 tacked onto your Medicare Part B, and it's not a one-time, it's a lifetime penalty.
Oh, wow. So it's a significant penalty.
Absolutely, and it can go up every year when the Part B goes up.
Can people who have excess HSA money that carry into their 65 and older period, can they use that money to pay for their supplemental plans? Whoever feels that they can answer that the best, Arlene or Brian, can you answer that? Or Travis? And Travis, you can unmute so that you can join us too. Somebody want to answer that question?
So yes, you can use your HSA to pay your premiums and your copays for your medical services. Yes, you just can't continue to put money into your HSA account.
I see. So once you retire and you've got this, let's just say you have $10,000 in your HSA account, you can continue to draw that down. So I got another question. What about the premiums? Are the premiums for supplementals for couples or individual? You all put up numbers on there. I was just confused as to whether that's individual or couples.
Per individual.
Yeah.
Per individual.
Yeah.
And that is based on income, correct? When you based upon
Part B is based on income.
Part A is not.
Correct. And then,
There's no premium for A, correct?
Correct.
Unless you didn't pay into Social Security.
Right.
But most of the time it's $0.
So let me ask you a question on that, Carmen. So if somebody has a spouse that only worked for 5 years or 6 years during their marriage, are they going to fall into that category, or is it considered at that point joined?
No, they have. It's individual, and if they have not satisfied the quarters, then they will have to pay accordingly. If the spouse does not have enough quarters, so you can't borrow your spouse's. You have to.
And
pay.
so that's 40 quarters during their lifetime, correct?
Correct.
Okay. We had a question. I think that one disappeared. So let me ask you this. Perhaps Brian can talk more about the various plans. So let's just take, for example, a common situation where a husband and wife had been married for a number of years and they're both over 65, and they're trying to figure out what makes the most sense for them. If you could go over those supplemental plans a little bit more in detail and help us to understand a little bit more about what might be the advantages or disadvantages, or if there are any disadvantages other than cost, for those various supplemental plans. So Brian, if you could take us through that, that would be helpful.
Yeah, so basically, I guess we look at the supplement plan as kind of the Cadillac. Once you, let me pull up once you pay your monthly premium and then your one-time annual $203 deductible, that plan is gonna take care of everything.
That plan's going to take care of prescription as well?
No, you'll have to, as far as healthcare, then you'll have to add the prescription plan on top of it.
Okay, so the first ones, A and B, cover your hospitalization and your basic health care, but with copays associated with doctor visits, correct?
Once you have the plan G, you have a $203 annual deductible, and then that's going to cover everything. These three will cover everything, plus once you add the drug plan, then that'll cover your drugs as well.
And so the drug plans, if I'm looking at this correctly, The one is Humana, and it's $17.20. So each spouse would pay $17.20 to be, so $34.40 to have a prescription plan. And is there a copay under that prescription plan for those, for any drugs?
It depends on the drugs, specifically whether there's.
So some drugs have really high, are very expensive.
Correct.
So they're going to pay their $34.40 premium, plus if they happen to be on a drug that's, you know, $75, they might end up paying that $75 copay, correct?
Yeah, it just kind of depends on the drugs and what that specific plan is going to cover.
Are there any plans that eliminate copays on drugs totally?
Yeah, and then you'll just have a higher monthly premium for that plan.
So those would be the gold plans?
No, a gold plan down here, that's a Medicare Advantage plan.
So take us through that. Why is that different than the Medicare supplemental plan?
So a Medicare Advantage plan combines both your coverage up here, like the G plan does, with your drug plan. So it's all in one plan. And so what happens is it actually pulls you out of Medicare, and then your coverage is, you're now covered by the Medicare Advantage plan. So what they do is, so then there's zero premium for these plans. So what happens is the company, or the government, I mean, takes a piece of this $148.50 and they give it to the insurance company down here so that they cover all the claim work.
So why wouldn't everybody just automatically move to Medicare Advantage plans? It seems like that is the best choice. Because there's no premium.
Correct, but they also have deductibles.
On the Gold Plus, we actually don't have a deductible. It depends on the plan. So, and there's different coverages. So like an HMO is going to have a smaller network, a PPO is going to have a broader network. There's money involved there. So it's going to, you know, copays are going to be different. Drug costs are going to be different, et cetera, et cetera. So, and it depends on, you're talking about drugs earlier. It depends on the tier of the drug. So like your generics, you know, there's going to be low to no copay depending on which plan you're in, versus like your tiers 3, 4, and 5, which are more your brand name drugs.
So Travis,
it's also dialed into whatever that client, you know, their lifestyle. Do they travel out of state all the time? If they travel out of state all the time and they want more of the Cadillac plan and they don't care about the monthly premium, then they can use a G plan anywhere in any state. Whereas, you know, down here on the Medicare Advantage side, you know, if it's an HMO, then it's going to be very specific to an area. But there's also Medicare Advantage plans that are PPO that will be portable for that person that travels.
So if somebody has an HMO plan and they travel to New Jersey and get sick in New Jersey and have to go into the hospital, that HMO plan's not going to cover it?
Well, if it's an emergency.
Yeah, it'll cover emergency. That's more, so let's say somebody is a snowbird and they go to Arizona. So they live part-time here, part-time in Arizona. Mm-hmm. Well, they'll, you know, they may go to and get their annual physical done while they're living in Arizona. And so they may aim more towards the PPO or the supplement plan. But anything that's like an emergency case where you're just like traveling on vacation, that it will, Medicare Advantage with an HMO will cover them for that emergency.
So and not all HMOs are the same. For example, Kaiser. So Kaiser Permanente is in different states. So if there's like California, so you can visit Kaiser Permanente in any state and use their network there. So it also depends on the HMO and their rules. Some are a little bit more flexible. And if you go into a state where there is no, like New Jersey, and you end up going to the hospital, you can call, and most likely the plan will authorize you to see a local provider because they want to make sure that you're taken care of.
So it seems to me that if you have the means, the plan Brian had discussed, which is the G, would be a plan that offers the most flexibility for somebody who could afford the premiums, correct?
Yes, but on that as well, you're going to have to get a dental plan if you want a dental plan on the outside and vision, where a Medicare Advantage bundles all of those different things.
I see. So you don't get dental, you don't get vision basic coverage. So you'd have to buy both of those plans separately if you wanted to, or you could move to the Advantage plan, which bundles both of those in as well.
Correct. Yeah, and that's why we cater all of our meetings to exactly what that person's lifestyle and current situation is, so we can tie the best.
So I'm sure you guys have some stats on this. What percentage of Medicare enrollees are in these various plans? Is it heavied up toward the Advantage plan, or is it heavied up to the more the Cadillac plan that Brian, you had indicated?
I think we're seeing more people go to the Advantage plan. It all depends, on their health also. And again, like if someone knows that they're going to have surgery or something major coming up, sometimes they will go on the Medicare supplement plan for a year and then maybe transfer to a Medicare Advantage plan.
So you do have the ability to move around if you choose to do that during the open enrollment periods.
Yep.
You have once you're in an Advantage plan, you have 2 years in that plan that you can move back to a supplement plan
at any time.
If you after those 2 years, then you will have to requalify for that supplement plan when you wouldn't have had to do that when you first got into Medicare.
Yeah, so
we see a lot of advertising for these Advantage plans, so there's obviously a reason why there's so much advertising for it. Can you maybe talk a little bit about that?
Yeah, I mean, they're very popular as far as, bundling everything. I think it takes some of the pressure off of Medicare, and it diversifies that into an insurance company as well. Travis or Carmen, do you have anything else to add to that one?
No, you nailed it. I mean, the future is the Advantage plans. I mean, it's all risk assessment, right? So the more people get into these plans, the richer they're all going to get. And then the more expensive the supplements are getting because there's less people enrolling in those. So it's all risk assessment. I did see the stats on Colorado, and I cannot think of it right now at all. But I mean, you're seeing a tendency in the last 5 years, people coming off original Medicare and supplements and going into Advantage plans.
So we're seeing more.
That's the trend that I too am seeing. A lot of people are going into Medicare Advantage plans because everything is bundled. And it has a fitness plan, it has dental, and it has vision, sometimes a hearing aid benefit. So yeah, they're really good plans.
So can you talk a little bit because we have I've moderated a number of group discussions about hearing issues in senior years. What's changed in terms of Medicare's coverage of hearing aids for people? Because in the past they weren't covered at all, correct?
And I can only speak on Humana. So, I mean, I'll speak on behalf of Humana on this one. So in our plans, for instance, we contract with True Hearing, which is a company. So we have to go through True Hearing. They'll call True Hearing, and they'll set them up with a local audiologist depending on their location. Okay. And what's good about us is it's contract pricing. So when you get your sales kit, when we go over your summary benefits, that's the price you pay that year on hearing aids. And they give them 2 options, a couple of different channels for each option. And it's just depending on, again, it's all needs assessment, just like health insurance and everything else, depending on what they need.
So if you're in an Advantage plan and you want to go up to one of the more expensive hearing aid that are available out there that do a lot more than a basic hearing aid, can you utilize that supplemental benefit to pay out of your pocket for the rest? Or do you just have to say you're going to pay 100% of it because you're not using that option?
They, with our plans, they'll give you a certain credit. I mean, we got two good hearing aids in there. There's your basic, and then there is an elite level. Okay. So typically that's going to span, the coverage. But they will give a credit. There's just something outlined that, or if we can get a doctorized script on it, it's medically necessary. So, I mean, again, you're kind of opening a can of worms. We can go different ways, but there is a way to get that covered.
Okay, that's
And
interesting.
each plan is a little bit different and they're a little bit more flexible. So if you go outside of the network, you can file a claim and get reimbursed. So there's a lot of different ways to go about it.
So if you were to give advice to somebody who's in their 64th year right now, to help them understand what they're about to get into in terms of health Medicare, because in many cases, Medicare is a step up substantially from many of the high deductible plans that a lot of companies have moved to. So it's an advantage for people to go from a high deductible plan to Medicare. So if they have the option at 65, do you have to continue in your company healthcare plan, or can you move over to Medicare even though you have the ability to get a high deductible plan from your employer?
No, they can leave group coverage at any time. I mean, once they enroll in Medicare, that's an option. Or if they can go the other way, if they have great group insurance, they can delay that Part B enrollment. And
So that's interesting. Anybody else want to add anything to that?
I agree with Travis. Go ahead, Arlene.
I visited with clients and we really do an assessment, like, seeing like, oh, okay, your plan is probably better right now staying. Plus, we have to look at if they have a spouse that's younger too. So there's a lot of different factors you look at that. But I know a few clients within the last 6 months stayed with their group coverage because it was more beneficial for them.
Yeah, I was going to ask that question. What happens if your spouse happens to be a few years younger than the other person, and the husband's going on Medicare? They're going to need to continue the work plan as well to cover the wife, correct?
Absolutely. Yeah, it just depends on who's the policy holder and who's turning 65 first.
So you can't be enrolled in both. Is that what you're saying, Carmen?
That is correct.
Okay, so really it becomes a decision of what makes the most sense, right? Do they want to go into a basically a COBRA situation where they could pay out of pocket to be in one of the national health care plans, and the husband in that case can still go into Medicare, correct?
Yeah, there's just a lot of variables. Like Arlene was saying, you definitely want to make sure you know who's the policy holder. You want to know who's got what, if there's any children even covered in that plan. So yeah, it's better just to have a one-on-one with one of the specialists here in the panel, because it's just not a one size fits all.
Got it. Yeah, I'm just trying to get at some of those variable situations, because I think that's what helps people sort of think about their own situation when you bring up, you bring up various scenarios that might be involved. So let me finish that question. What would you say to somebody who's 64 and their spouse happens to be 64? We'll make it simple. With similar birthdays, that what are the things they ought to be most importantly thinking about during that 64th year as they begin to move and think about Medicare? So if you had to give that piece of advice, I'll ask that question of each one of you, and Brian, you can start us off, and Arlene.
So in other words, what would you tell a 64-year-old to prepare for?
Yeah, in other words, your neighbor comes up to you and says, "Hey, Brian, I'm turning 64 and I got a year before my Medicare. Well, what are the things I ought to be thinking about right now?"
Well, just that you can, I guess I take it back and say, if you have that time, you have group coverage, is there anything that you need to get done if you have dental vision that would be more beneficial on a group plan, even though Medicare, you know, is good coverage? That's where I guess I would start. And then, you know, you can enroll in Medicare 90 days before you turn 65. So that,
But you're not covered right before you're 65?
if they're still on a group plan, right?
Well, you had mentioned that, and I was curious about that. So if you can enroll 90 days before 65, does somebody qualify for coverage prior to 65?
Yeah, so you enroll and you just have your start date on
your birthday.
on your birthday.
On your birthday. So there is no coverage for Medicare prior to age 65, even though you enrolled.
Yes, unless there's somebody on Medicaid can be on
Right,
Medicaid.
right. That's a different issue, right?
That's a
Medicaid.
different story. Yeah.
Carmen, any advice you might give somebody in that 64th year? Those were good, right?
Absolutely. So first of all, I would ask what their budget is, their cost for premiums. I would ask their health. Are they pretty healthy? Do they need specialty care? I would talk to them about their choice of doctors. Are they stuck with one specific doctor? And then if they travel, what's important to them? So those are the things that I would have them consider. And then it will start on their birth month. So if they're an October baby, it will start the 1st of October. So they won't have any coverage with Medicare prior to enrolling. It'll start the 1st of their birth month.
Okay, excellent. Great points. Travis, anything you would recommend to somebody who's in that 64th year to be thinking about?
I mean, just a real needs assessment. I mean, Carmen kind of nailed it. It's a lot of financial. Where do you see yourself in 5 years? Are you traveling? Are you going to be a snowboard? You know, just things like that. So no, pretty much echoing what Carmen said.
Yeah, those are all really interesting points because, you know, I think a lot of people don't necessarily, it's hard to understand what all those variables might do to your choices of plan unless you actually do enough research yourself or you have somebody help you with it. So I think that's really, really, really good advice. Is there anything that I've missed asking that you think I should have asked, or you might want to say, hey, I thought about this, and this is something that I think this panel should address? I'll start with you, Travis.
I just make sure they're talking to a licensed agent. I mean, even enrolling in Medicare, you don't want to miss penalties, right? You don't want to delay your Part B if you don't need to. You don't want to get a drug penalty, you know, by missing a drug plan if you go to a different plan that doesn't have drug coverage with it. Just, you know, talk to somebody who's done it for a while that's licensed and knows what they're talking about.
Cool. Carmen, anything that I've missed that I should have asked or that you want to make sure that our audience hears?
Yes, Al, thank you for asking. So a couple of things that people should consider is when you're selecting your health plan, is it a comprehensive healthcare plan, kind of like Kaiser Permanente. At all of our clinics, we have doctors, we have specialists, we have our own pharmacy and lab department and imaging department. So it's very convenient. So it's a convenient care. So how important is it to you to have everything in one house versus going to a doctor over here, a specialist over there, the pharmacy over here, and labs over there? And then are they in communication? Do they communicate? I know with Kaiser Permanente, they have a system where all doctors can link in and see each other's notes. They can see the labs, they can see the doctor's notes, any testing. So yeah, so that's really important for others to consider as well.
Great advice. Brian, Arlene, anything from your perspective that I should have asked that I haven't asked yet?
You know, I like to tell my clients to, who's looking at the different products, you know, whichever Humana, United, Kaiser, that every year that we can review this. So I came from like, oh, am I stuck with this product? That's what's nice. Every year that they can change if they want, they can review it. So sometimes during the year they have a product and they go, oh, my friend has this product. So they know that they can make a change and that they're not just, with one company, because I'll get asked that like, oh, is this only, or can I change it ever? So I think that brings them peace of mind, because sometimes when you're new going into this, you're wondering if you made the right decision with the right carrier. So I think that's a good thing to let your clients know, that they always have the opportunity when it's annual enrollment and other different special election periods that they can make that change.
That's great advice. Brian, anything from your perspective?
No, I mean, I think you did a pretty good job moderating it, and everybody chimed in. Not anything really that I can think extra.
Do you see any big changes? And this can go again right through the group. Do you see any big changes coming down the road in Medicare management or pricing or anything like that, given the fact that we've got a massive baby boom generation that's in the process of retiring and will continue to do so for the next probably 10 years?
I mean, again, it's risk assessment. So I think Advantage plans, the more people enroll them in them, it's going to improve because you have that many more people paying into them. So it's going to get better.
Okay.
Absolutely. Absolutely. I think that because there's more people enrolling in especially Medicare Advantage plans, I think that their copays are going to be lower and they're going to be offering a lot more services and or things to entice them with. So yeah, definitely. Lots of changes coming up.
Yeah, it's a super competitive space. So that they change every year. And so that's what we consistently see is one year, United might be the best plan. The next year, Humana might be the best plan. So that consistent change because of the competitive nature of the business.
And so maybe, Brian, you can help us understand how does your company get compensated for your support and help?
Everybody gets compensated by the insurance companies once you sell the product.
I see. So you're working off a commission program from the individual insurance company that makes the most sense for that client.
Yeah, and besides somebody that's captive with a company, that's how the brokerage world works. So every company pays you basically the same. So you're not incentivized or biased towards one or the other.
Got it.
Because they all pay basically the same.
Mm-hmm. And Travis, is it similar on your side?
Obviously I get incentivized just for Humana and Humana products. There might be some changes to that in the near future, like as we grow and as baby boomers. There might be some changes. We might do some other contracts, but at the moment, yeah, we're a little different because we are the only, besides Kaiser, we're the only captive agents out there. And it's I don't know, like you said, it's a big business, and it's all needs assessment. So we're not always the best fit for everybody. But we have some sort of plan or product for somebody. So
you have good plans this year,
and next year.
Well, I don't see any other questions, and I am really impressed with this group. I think you guys were very helpful for people who are, I'm going to be 64, so it was really interesting for me in particular, and I'm sure it was very interesting for our participants that are involved in this lunchtime conversation. So, Arlene and Brian and Carmen and Travis, I just want to say thank you for taking the time to share your expertise. And I'm sure that you'll all get calls from some of the people who have more questions and want a better firm understanding and do a really good solid needs assessment on their side to understand what's going to be the best plan for them.
Well, thank you so much for your time and doing such a good job moderating.
Thank you so much, guys, and have a great afternoon. Hope to see you soon.
Thank you, Al.
Thank you.
Bye.
Bye-bye.